make your presence felt in this meeting. We have Northeast India Union College. Northeast India Union College, are you present? Northeast India Union College. And if you're there, how many participants? Kindly respond to this. We also have from Lowry College, and if participants are there, please you can say yes. How many participants are there from Lowry College? The next, we have participants from Roorkee College. Is there any representation from Roorkee College? Then from B.Ed College, Vellore. B.Ed College, Vellore. Then from Spicer College. Then we have from Metas, that includes from Surat, from Ranchi, from Newswid, and other place.
Yes, sir.
Yes, yes.
Yes, sir. Yes, sir.
Yes, I see few hands raised.
Yes, sir.
Yes,
I
sir.
want to welcome you, and as you all attend this webinar, that God will bless your presence, and the messages that we get may be used in the field for His glory and honor. We also have the pastors from the field. That includes all the 7 unions, pastors and health directors. Are you there, please? From all the unions, pastors and health directors. We also have chaplains who are attending. And we would like to welcome each one of you for this webinar. And as people are entering, we would like to welcome. When I started this one, we had 63, now it is 100 members. And we have some limited numbers that we'll be accommodating in this Zoom conference. But those of you who are not able to, kindly on live in YouTube, you can view this program and make yourself attend this meeting. As you all join in this webinar, may God bless you. And I hand over this time to Dr. Edison Samraj.
Thank you, Pastor Augustine, for the review of the participants from various institutions, the various unions, as well as the colleges that we have. And I'm happy that all of you are present. And we are about to begin our program. And the time is exactly 4:30. And it's time for us to begin. For those who are just joined in, I would like to welcome you for this very important and significant event in the life of the church in Southern Asia Division. We have organized this in association with the General Conference, the Ministerial Department of our division, Education Department of our division, the Youth Department, the Chaplaincy Department, and of course, all the major colleges of our division represented here, especially the 3 colleges that we have had here, especially from Roorkee, from Spicer, and from Northeast India Union. We have the Vice Chancellor of Spicer Adventist University, Dr. Sanjeevan, and Dr. Paul, Bhagyan, the Vice Chancellor, who is also present there. So I believe that we have done well to work in association with this group to make this webinar a real meaningful event. Now you may be wondering why we organize this important webinar. And the reasons for that we will share with you just in a few minutes and moments. And before that, I would like to request Pastor Ramesh Jadhav, our chaplaincy department head, to offer the prayer of invoking God's presence as we celebrate God's goodness through this. Pastor Ramesh Jadhav, our chaplaincy head.
Let's pray. Our most gracious, loving Heavenly Father, this afternoon we have assembled together from various places through this electronic media for this very important meeting conducted by the Health Ministries Department, collaborated with many other departments and through the assistance of General Conference to discuss and to learn more about the mental health issues. We want to thank you for this opportunity wherein we could join together through this electronic media, dear Lord, to study, to ponder, to recognize the issues in the life of individuals, institutions, hospitals, colleges, and the high schools. So that, dear Father, we will be able to meet the challenges what we face day to day into our lives. This afternoon, we want to thank you, dear Father, for the organization itself, the Department of Health Ministries as Southern Asia Division, as well at the General Conference level, down the line with the unions, sections, and conferences. As we all united be working together, may we all work together for one goal, that is for the salvation of mankind. Dear Lord, as pen of inspiration stressed, dear Lord, every department is the attribute of bringing souls at the foot of Jesus Christ. We want to thank you for these ministries you have given into the church. We want to thank you, dear Lord, for the structure of the church, what we have. And as we do collectively and individually our parts, may it be blessed by you, so that, dear Father, we'll able to cooperate together and bring in the results which you want us to bring in, so that people will come to the knowledge of saving grace. As we live upon the face of this earth, our health issues are very important. A sound mind, a sound body, which is very important, so that, dear Lord, we'll able to focus our attention spiritually once we are sound. Therefore, help us to recognize the fact of our bodies and our minds and connect ourselves to you, our Savior Jesus Christ, so that we will be fit on this earth and bring many people to the knowledge of this important issue. Bless Dr. Edison as he leads out in today's meetings, and many others, the chair, Pastor Lakra, as we see on the screen, dear Lord, is going to guide us. May we all able to work together to the unity and the one goal, that is of saving of mankind. Bless the participants, those who are here. In Jesus' holy name we ask. Amen.
Thank you, Pastor Jadhav, for your kind words as well as your prayer offered to invoke God's presence in our midst. Now, let me introduce the theme, the chairperson, the chief guest, and the speaker. Now, the theme that is chosen for this afternoon's webinar is entitled Mental Health Pandemic of COVID-19, Strategies of Mental Health and Well-Being. Now, this is basically the theme that has been chosen for us to dwell upon and reflect upon. Now, mental health is defined by the World Health Organization as a state of well-being in which the individual realizes his own abilities and can work productively and contribute to the community to make the community whole. Now, why did we take this exercise of making this webinar happen in Southern Asia Division? We are part of the global family, and we need to create awareness of this mental health issue in a focused way. Creating awareness among our generation is critical. Unless we know what the issues are in relationship to mental health, we are going to be lagging behind in responding to it maturely. The second reason for organizing this event is to orient our membership, our leadership on issues that we need to face and address. We cannot run away from our problems like an ostrich. We need to face them just as they are and make ourselves clear on how we respond to it as a church. The last but not the least is to offer a strategy to manage the crisis in a holistic manner. So these are the objectives in which we are taking up this webinar at the global stage. The second part I want to emphasize is we are in the midst of a world that is with mixed anxieties, deep depressions, and also there is a sense of purposelessness, meaninglessness, nihilism. And this has pervaded the entire globe, and there is a fear psychosis that is overarching the entire human race. And therefore, it was felt that we must coordinate efforts from people who have studied the subject in depth so that they can come forward in giving us a focus that will help us to mature our membership and our leadership to these vital issues. So today I've introduced the theme in a very simple way. It is to understand how we respond to mental problems in India. Now let me come to the chairperson. The chairperson is no stranger to us. He is a very distinguished personality in the Indian subcontinent, and he has served as an executive committee member of the Southern Asia Division, and he is a very well accomplished academician. He completed his master's in Pune University, completed his PhD and his MPS in the International Institute, Bombay. He did his postdoctoral studies in Deccan, Australia, and he has presented papers in many Adventist universities, including Andrews University. At present, he is the Vice President for the Indian School Psychology of India, and he is also a very thoughtful, thought-provoking speaker. And today, I have requested him to be the chairperson for the session because he is one of our outstanding psychologists in India. So we welcome you, Dr. Solomon, to be our psychologist friend here at this webinar, to be the chairperson leading the discussion after the presentation is made by Dr. Torben. Now we come to the chief guest. The chief guest is not a stranger to anyone here. I believe that all the members who are attending this webinar know this person very well, and he is the division president, Pastor Esras Lakra, who has served the division for many, many years in all capacities, from the pastor, section president, union presidents, as well as being the division educational director, and also served as its president for this term. And we want you to know that he is committed to health message. He is supporting all the initiatives that we have taken, and we are thankful to him for accepting our invitation to be the chief guest and also to distribute the certificates of participation along with Dr. M. Wilson, who will be here offering the closing prayer. We want to welcome him with a shawl, and I now come forward to request Pastor Lakra to come forward and accept this very gracious gesture of welcoming you as our chief guest. God bless you. Thank you. Please be seated. And now I take the time to welcome the speaker, Dr. Torben. Dr. Torben, are you there? Can we see you? Dr. Torben is the Associate Director of the General Conference Health Ministries Department of the Seventh-day Adventists. He originally comes from Norway and comes from a pastoral family. He has served the church as a youth Sabbath school leader. He has got his MD in Copenhagen University. He did his residency in psychiatry in Oslo University, Norway. He is trained as a psychotherapist. As a psychotherapist, he has taken special interest with patients with depression, anxiety, and personality disorders, as well as taken up issues on integrating relational, religious, existential issues, and had perspectives in psychotherapy outlined. He has also served as a chairperson for the depression department in Norway Hospital. He specializes in psychotherapy treatment, and in 2015 he accepted the call to serve as the Health Ministries Director for Trans-European Division, and 2018 as one of the Associate Directors for the General Conference. I also want to tell you he comes with a special focus on mental health and well-being for the entire world church, and he is one of the authorities on mental health. And he has some interesting things about him which I want to share. He has climbed the highest mountain in Europe, and he's a very knowledgeable person on the subject and very supportive and committed to the well-being of the church, social health of the church, the emotional health of the church, and the spiritual health of the church. So we welcome you, Dr. Torben, to present your presentation today on the topic that is assigned to you. So I hand over the time to the chairperson, Dr. Solomon, to make his few remarks before the presenter makes his presentation. Dr. Solomon, the time is yours to make the presentation. But before that, we have our chief guest to respond for a few minutes on the necessity and importance of why this seminar is being held. Pastor Lakra, we are very happy that you could be with us. And before the chairperson takes over, we would like you to give your gracious remarks.
Thank you. Thank you, Dr. Edison, Samraj, for this webinar we organized in Southern Asia Division. We are happy that this webinar on the mental health and a strategic plan that we have how to combat the fight the COVID-19, and there's the health issue to be discussed. We are happy to have Dr. Torben. We are so happy. Welcome you. We have Dr. Solomon, R.J. Solomon, and we have worked together. And it is nice that we are able to, you are being a chairman for this webinar. Now this Southern Asia Division, the Health Ministries Director, Dr. Edison Samraj, who has organized, we are happy. And this webinar will be much useful for all of us, and particularly in Southern Asia Division. We have the participants or the viewers from all the colleges and the unions. We have from the hospital, the nursing school or nursing college. I'm so happy to have about 100 of you have joined, and it's encouraging that when the pandemic has been, it is spreading across the world, and we need to be aware of how we need to take care of this, the microorganism. Now that has been as a problem, has created a fear and the stress. There's an uncertainty, and we know of us that we are not very secure. Our traveling is limited, And because of this fear and the anxiety that has this COVID-19 has created, and it affects our brain, or I would say our mental health. That's we need to take care. And it's because of the fear and anxiety, the trouble and the problems that we have. We need to know it, how this can be controlled, or how we move about, how we go about. And it's an important this webinar as the presentation is made, and we will be listening, and it will be an opportunity for all of us that what we learn we would tell to the others. And I'm very happy for this webinar has been organized so that we all participate. And it's an important that we would understand uh, and how to cope up with the COVID-19, and we do not have any fear and anxiety and give a stress to mental, and we know that we will able to be strong, we will able to live positively in spite of those fear and anxiety we have. So I'm again thankful for organizing such an important topic, an important, I would say, is in a mental health strategies, coping COVID-19 as a very good title has been selected, which will be much beneficial to all of us. And all the viewers and participants, you will be richly blessed, and we are thankful again for Dr. Edison Samraj, who has organized this webinar. We will be much benefited by this webinar. Thank you, and God bless us all as we participate for an hour or so. God bless us.
Thank you, Pastor Lakra, for your keynote response as a chief guest. And thank you for being here despite your hectic schedule today. And I want you to know that your presence here has been a blessing to all of us. And as you take the responsibility of supporting the health ministries to the 3 countries that we represent, I hope and pray that this presentation will make a very strong impact. So now I hand over the time to Dr. R.J. Solomon, our chairperson, to make his few remarks, and then our presenter, Dr. Tobin, will take over. Dr. Solomon.
A very good afternoon to everyone. I'm not sure whether you're able to see me, but my video is on from my side.
We are able to see you, Dr. Solomon.
Okay, that's good. I'm not able to see myself. That's why I asked you. That's fine. I'm sorry that I could not get back into the system ahead of time because we had some difficulty. I think the program has received a tremendous response. There were too many people joining in, and it was certainly made it difficult for everyone to join in at the same time. But happy to see you, all of you. Now, without taking much time, I would want to invite our speaker, because it's once the speaker speaks, then we will have certainly much to speak about. But I just want to remind you all that, as we all know, that we are now experiencing this pandemic. It's over a year, and it certainly created a mental health havoc. Now, I just want to remind you that, when this SARS virus struck the Far Eastern countries, immediately after that, after the SARS was brought under control, there was a serious problems of mental health were noticed in those countries, okay, as a result of the SARS virus effect. But now today we notice that the coronavirus effect is much more stronger and heavier, and has been spreading all over the world. And as a result of it, the scientists are saying that we are going to have a second epidemic. Well, I'm not talking about the second wave and third wave of the coronavirus, but second epidemic, that is after the coronavirus, it is said that we are going to have a mental health epidemic, and that's going to be even more worse than the first epidemic caused because of coronavirus. Well, this is what an expectation is, and I do not know how it is going to turn out to be, But then it's very interesting that we be prepared for this second epidemic also, and understand how our mental health is going to be affected because of this coronavirus epidemic at this moment. Well, I now invite our speaker to come forward. I think Dr. Edison also would be conveying his invitation. Thank you. Yes, Dr. Edison, over to you.
I just want to thank you, Dr. Solomon, for your willingness to share the session today. Now, I want to invite Dr. Torben, the Associate Health Ministries Director of the General Conference, to make his presentation on the theme. Dr. Torben, the time is yours.
Yes, thank you. Thank you very much. I'm happy and privileged to be with you this afternoon, this morning, my time here in just outside Washington, D.C. It's amazing how we've learned how to do things new ways during this pandemic. I have not had the privilege yet of visiting India in person, but I'm happy that I can be with you this way through electronic means. And I really also want to thank you and commend you for putting this topic of mental health on the agenda. It's a very important topic. We've been for the last year working with COVID-19, the pandemic of that, but as Dr. Solomon said, also we are expecting and we are already seeing a mental health pandemic around the world. And I'm not an expert on the situation in India. For that, you have local people, but I've looked at some of the reports coming out of India also, and what I am struck by is that around the world, we are seeing the same trends. People struggling significantly, as was mentioned, anxiety, depression, hopelessness, meaninglessness. What is the future going to look like in this world? And what we also are seeing that particularly young people are struggling a lot in this situation. So what I would like to do today with these two presentations is, one is to focus specifically on what is the current situation, what are the challenges that we are facing, what is the evidence that we have, and why do we particularly now need to focus on mental health. But then this mental health challenge that we are facing in a special way right now, it's not a new problem. It's not a new challenge. Mental health issues are a major source of distress and suffering around the world, and they have been that for a long time, probably more or less as long as there's been human beings living in a sinful world. So this is something that we are struggling with. Unfortunately, the challenge that we are facing is that mental health issues, mental illnesses are not recognized and acknowledged to the same degree sometimes as physical illness. There's a lot of stigma associated with mental illness. There are limited services, support, help available in many cases around the world for these issues. So many people suffer in secret, in silence, which has great consequences for the individual, but also for society. So now I'll share my slide with you. And as was said, we called this, and as Dr. Solomon referred to, the mental health pandemic of COVID-19. This is really what we are facing, and again, especially for young people. These are just the latest statistics that I had from yesterday. More than 120 million people have been confirmed sick with COVID-19, and more than 2.6 million people are dead from COVID-19. These are the estimates and best numbers that we have. And the tragic thing is with these deaths and with people being sick is that these could have been avoided. If we had not had this illness, some say, well, 2006 million people dead, that's not so much. There's so many people dying in the world every year anyway. But that's not recognizing that these are excess deaths that we are facing. And that's why we need to be so intentional about preventing deaths, preventing illness, and doing what we can. And of course, India, you are ranking quite high on the list of numbers. You have many cases, you have many deaths, but you also are a very big country. But it's definitely, it is relevant for your territory, the three countries that your division represents. Antonio Guterres, the Secretary General of the United Nations, in May last year, he and the United Nations launched an initiative really highlighting the emphasis on the mental health challenge of COVID-19. And he said, in general, COVID-19 pandemic is the most challenging crisis we, that is the world, has faced since World War II, the biggest challenge we have faced in so many ways. And for most of us, we have never experienced something as disruptive to our lives as this pandemic has been. Most of us have been affected in significant ways, even if we haven't been sick, even if we haven't directly struggled with a mental illness because of it. I think, and that's my experience talking with friends, colleagues, family, also, that most of us we feel the effects in various ways, not just the physical isolation, social isolation, the inability to move and travel as we used to, but also the mental health effects of it. And I want to share with you just the short introduction that the Secretary General did on this situation. This is from May last year, so it's a while ago, but it's still really very relevant, where he's highlighting the issues of COVID-19.
Mental health is at the core of our humanity. It enables us to lead rich and fulfilling lives and to participate in our communities. But the COVID-19 virus is not only attacking our physical health, it is also increasing psychological suffering. Grief at the loss of loved ones, shock at the loss of jobs, isolation and restrictions on movement, difficult family dynamics, uncertainty and fear for the future. Mental health problems, including depression and anxiety, are some of the greatest causes of misery in our world. Throughout my life and in my own family, I've been close to doctors and psychiatrists treating these conditions. As Prime Minister of my country, Portugal, and as High Commissioner for Refugees, I became acutely aware of the suffering they cause. And this suffering is often exacerbated by stigma and discrimination, what is absolutely unacceptable. After decades of neglect and underinvestment in mental health services, the COVID-19 pandemic is now hitting families and communities with additional mental stress. Those most at risk are frontline health workers, older people, adolescents and young people, those with pre-existing mental health conditions, and those caught up in conflict and crisis. We must help them and stand by them. Even when the pandemic is brought under control, grief, anxiety, and depression will continue to affect people and communities. This is the background to the policy brief on COVID-19 and mental health that we are launching today. Mental health services are an essential part of all government responses to COVID-19. They must be expanded and fully funded. Policies must support and care for those affected by mental health conditions and protect their human rights and dignity. Lockdowns and quarantines must not discriminate against those with poor mental health. As we recover from the pandemic, we must shift more mental health services to the community and make sure mental health is included in universal health coverage. The United Nations is strongly committed to creating a world in which everyone, everywhere, has someone to turn to for psychological support. I urge governments, civil society, health authorities and others to come together urgently to address the mental health dimension of this pandemic. And I call on governments in particular to announce ambitious commitments on mental health at the upcoming World Health Assembly. Mental health is at the
So this is a most urgent appeal from the highest level of institutions, organizations in this world. United Nations and many others have followed in urgently appealing to take seriously the challenges of COVID-19, including the mental health challenges. And definitely when Antonio Guterres is appealing to civil society, also that includes churches, religious institutions, and that is something whoever we are, whether we represent a church, educational institution, some kind of entity in the community society that we are, we all need to be aware of the mental health challenges people are facing and to do what we can to support and help them. I would like to make this statement that you see on the screen, that COVID-19 is not merely an infectious disease. In a way, you can say it's a virus, it spreads, it's become a pandemic. So definitely it is an infectious disease. But it's so much more than that. The implications of COVID-19 are comprehensive. And in that sense, we can say that it's beyond the biological aspect, the infectious aspect of it. It has psychological, social, and even spiritual implications and consequences that we need to deal with, all of them. And just for some perspective, how has it affected us in these various dimensions of life: physical, mental, social, and spiritual? Physical health, more than 2.6 million people are dead because of it. More than 100 million have been sick. Challenge is access to healthcare is down. I was talking with a friend from Brazil yesterday, and she told me that now the hospitals are full. If people get sick, they cannot get into hospital and get treatment for other issues. Very scary situation to be in for a country. And this has happened many other places, that we've been limited access for treatment also of other issues, health issues that we've had. Other as consequences, physical activity for many is down because of less mobility, less time outside. How has it affected our sleep, our time to rest, our diet? Can be various ways. For some it may have improved, for some it may have worsened. The mental health, for many people, media consumption, screen time is up. We know for sure now that depression, anxiety, stress, and trauma disorders, as well as substance abuse and even suicide, is up because of that. So significant and actually quite dramatic changes in mental health, as I will show you later. Social health, less mobility, less travel. Many people work from home, are with their family maybe 24/7, a new situation that people may not have been into before. Connection with other people, family, friends may be down, face-to-face interaction down. We know that loneliness is up significantly, and unfortunately also domestic violence, abuse in homes of spouses, of children, can be parents, other people within the home, a tragic consequence of the stress, increased stress that people are facing. And then if we look at the existential or spiritual dimension of life, hopelessness, many are struggling with that. Meaninglessness has already been mentioned. Many struggle with the future, not knowing what to plan, not knowing what to think, not knowing what to expect. For many, monotony is up. And then also the question from a spiritual perspective is, how has this affected our relationship with God, the time we spend with God, our sense of closeness to God, and also the trust that we have in God. So as you can see, this is not merely an infection that people are catching. This has really affected all dimensions of our lives. What are the consequences in India? And again, I'm not the expert on your context, but I found a couple of articles. This one published in a journal of the American Psychological Association, saying something about the impact you have seen in India. And it says, this is from August last year, COVID-19 is expected to have devastating mental health consequences in India. And this is strong language. When you find this kind of language in an academic journal, it is really serious. Devastating mental health consequences in India through multiple pathways. And they say one of the challenges, lack of access to mental health resources and care, which is a global problem. Stigma about the virus and mental illness, both of them, is a challenge also in terms of seeking help. And then widespread prevalence of untreated trauma and other psychiatric conditions. It's not that all people were doing well before COVID-19 came. Many were already struggling, and they are particularly vulnerable in this situation during this pandemic. So people who weren't struggling before, they may be struggling. People who were struggling, they may be struggling significantly more than they were before. Other issues in India, communal tensions, unemployment, police brutality, starvation, things that all contribute to the mental health consequences. What have they seen? This is back in August, and there may be new reports now that show this even more. But they say mental health helplines have reportedly been inundated with callers complaining about anxiety, people asking for help, people struggling. Reports of suicide attempts and death because of the pandemic, clear connection there. And also further adverse mental health consequences of the pandemic and lockdown because of issues like poverty, illiteracy, social exclusion, victimization. Again, the ones who already are vulnerable seem to be even more vulnerable during this pandemic. And again, in this article, they reflect on some of the responses that people have had that have been helpful and unhelpful. And these are then referenced specifically to the Indian context, but we've seen the same things other places. Helpful responses, this example of Indians on the 5th of April, lit candles or lamps for 9 minutes expressing solidarity in the fight against the pandemic. The frontline workers, the healthcare workers have been under so much stress and pressure, and it's beautiful. These public demonstrations of support and solidarity that have happened around the world, and I'm happy also that it's happened in India. And it seems they also say Indians have remained connected with their family members and friends through messaging apps. Fortunately, with the technology, the opportunities that we have, people have been able to stay more connected during the pandemic. And that's a good thing. I've been recommending to people that should try to see and interact with a face every single day, even if it is on screen. screen. But then some of the unhelpful things that have happened, and these are also things that then are reported in India, but also we've seen this around the world, huge challenges with myths and misinformation that have been spread in social media, in news, in various ways, where people have spread information that make people worried, anxious, and also make people not do what is appropriate in order to protect themselves and protect others, protecting society. We have had huge challenges here in the US with these issues, where things have become very political, which has not been a good thing, but this has been a problem around the world. And this is something where it's very important also that whenever, if you are in some kind of leadership position, you have a special responsibility, not in spreading information, news that is not correct, that is not true, that is not helpful to other people. As leaders, we have a especially responsibility, and we need to take extra care in making sure, verifying that whatever we share, that we don't share things just because it's interesting, because it's fascinating, but that we really check the sources and know that what we are sharing is true and accurate. If not, better leave it and don't send it in WhatsApp, put it on Facebook or whatever means things are being spread. And unfortunately, also within our church, as in society in general, many people have been caught up in these myths and misinformation, and it's been harmful, and it will still be a challenge going forward. This is a huge problem. Then issues with violence against health workers, unfortunately first responders, and also individuals suspected to have or caused the spread of virus, been a huge problem many places, also very unfortunate. It doesn't help anyone, doesn't help anything, but people taking out their rage, their anger, their fear on others. So these are just some of the issues that we faced. Then I also found in the journal Lancet, which is a leading journal, medical journal, this comment, COVID-19 and adolescent mental health in India. And I just want to share also some of the things they highlighted, because this is what we are seeing around the world, that the young people, adolescents, kids, adolescents, young adults are particularly vulnerable to the mental health challenges of COVID-19. Say schools remain closed and online classes have replaced classroom teaching. This situation provided children and adolescents with the perfect, not that it's a good thing, but the perfect conditions for solitude and increased internet use. Coronavirus might not be as lethal in children and adolescents as it is in adults, and especially in older adults and people with pre-existing conditions, but it does cause a lot of psychological distress in this age group. And this is also want to share with you some US data to highlight this. Adolescents are experiencing acute and chronic stress because of parental anxiety, disruption of daily routines, increased family violence, again, very unfortunate, and home confinement with little or no access to peers, teachers, and physical activity. And then what is a challenge is during this pandemic, adolescents at high risk of psychological problems might fall through the safety net provided by protective family, peer support, and psychological support from teachers. Young people who otherwise would be maybe identified that they're struggling because they're not interacting with others now. They may not maybe discovered that they actually are struggling. And then the appeal is, it is time to address adolescent mental health in India systematically. And I would welcome this statement. It is time to address adolescent mental health in India systematically, to monitor the incidence of various psychiatric disorders, and to identify factors for both risk and resilience. And I will talk more about that later. Parents can be trained to identify signs and symptoms that suggest poor mental health, such as sleep disturbance, excessive anger, and difficulty concentrating. And I think this is when you are in, especially if you're a parent, if you're a teacher, if you work with young people, you should educate yourself on mental health, so you know and can identify some of the signs, reasons to be aware, saying, is this an individual that needs special care and attention and help and support to develop optimally and become the person they have the potential to be. Coming across here to the US, what is the situation here that has been reported? And I think it's still, even though this is the United States, it's a different continent, different culture in some ways, but still we see the same trends around the world. I'm doing presentations around the world, looking at data from the local areas, and I see it is the same trend that we are seeing all around the world, the same challenges. We're all human beings. We're all in this together in a way, and it affects us in similar ways. So this is just a very interesting report from the CDC, Center of Disease Control and Prevention in the US, that reported in August last year that 40% of US adults reported struggling with mental health and substance abuse. 40%. 2 in 5 are reporting struggling with mental health or substance use. That is significantly higher than the numbers that are usual. Especially anxiety, people reporting symptoms of the anxiety disorders was up approximately 3 times compared to what is normal, 3 times up. Prevalence of depressive disorders up 4 times what is the normal, what we had like just from the year before. So these numbers, not the exact numbers in themselves are not that interesting, but what is up is significantly that rates are significantly up. And also people thinking about suicide, significantly up. People having seriously considered suicide in the last 30 days were up more than double than what's been previously reported. Then we see which groups are particularly vulnerable in this. And what was found was that, again, the young people were especially vulnerable, 18 to 24-year-olds. This study didn't have, I think, younger than 18, but in this young age group, 18 to 24-year-olds, 75% were reporting struggling significantly. And also when it comes to thoughts about suicide, 1 in 4, 25% of these 18 to 24-year-olds in the US were reporting having seriously considered suicide in the last 30 days. And these are really alarming numbers and figures. Here, a report from the American Psychological Association. They publish every year a report on stress in America. This is the report for 2020, published in October last year, saying that Americans have been profoundly affected by COVID-19. And what they say, that we are now facing a national mental health crisis that could yield serious health and social consequences for years to come. And this is really serious. here in the US, the American Psychological Association said this is a national mental health crisis, that they are stating this is the situation that we are in now, and this will be with us for years to come. And that's why I think it's so important that wherever we are, wherever we work, church or educational institutions, that we know this is going to stay with us for years ahead. And that's why we cannot just say, okay, let's when the spread of the virus is over, where people are not getting sick from the virus anymore, then we'll return to normal. We won't return to normal. That is the reality we are facing. Many people are going, because of this experience and the consequences of this pandemic, people are going to be struggling for years ahead. And again, they also highlight the younger generation, what they call the Gen Z generation, Gen Z teens aged 13 to 17, and Gen Z adults aged 18 to 23. And they're saying they're facing unprecedented uncertainty, are experiencing elevated stress, and are already reporting symptoms of depression, increased symptoms of depression, and many other mental illnesses that they are reporting. So again, the same message coming out as you saw reports in India, here in the US, American Psychological Association highlighting that the young people are especially struggling. They say here about Gen Z adults in the US that they have largely grown up during times of disruption and unrest. Some of us who are older, we grew up in a time where things looking like everything is going well, things are moving in the right direction, having an optimistic perspective on life and the future. Many of the kids and young adolescents, young adults, they enter into adulthood with pessimistic expectations about what is ahead because of the state of the world, the state of the countries they live in. And that significantly affects their mental health and well-being. Gen Z adults really struggling, the young ones with uncertainty of their futures. 50% saying that the pandemic severely disrupted their plans for the future. 51% say that the pandemic makes them feel like planning the future simply is impossible. And like these are the adolescents, they are ready to enter into adulthood, and they feel they're struggling so much with planning and knowing what to expect for the future. The hope, the meaninglessness, these things are a huge issue for these young people in our society. Again, this report also said that adults struggling, increased stress. Again, the message just is so clear. People are struggling because of this pandemic. So this is a major issue that we all have been facing and have impacted us in various ways. Then before we do some Q&As, I just want to run quickly through what are some of the signs that you should be aware of. As was stated earlier about India, parents need to be trained in signs, how to identify, understand if a child is struggling, but the same applies also as we are pastors, teachers, health professionals, friends, family. We all should have our radar on in regard to what are people around us, how are they doing, how are they feeling, how is their mental health and well-being. And these are just some indications, and there's a link there to a website that lists these and have more information. And like you may be overwhelmed. I don't expect you to remember all of these things, but just sort of indications. Again, what I would say, if you have a gut feeling, even though if you can't say clearly or analyze what is it that makes me worried about this individual, but if you ever have, you get the feeling, I wonder how this person is doing, then maybe you should ask the person, or make sure that someone is doing something to explore what is the situation for that individual, how is the individual doing, what kind of support, what kind of help do they need. So here, just a list of some signs and symptoms, some things to look out for. And this also like to identify in yourself, if you are struggling with some of these issues, that may be an indication that you need to take care of your mental health and maybe get some help for it. Excessive worrying or fear as indication, feeling excessively sad or low for a time, people being somewhat confused, problems concentrating, problems learning, mood swings, people being irritable, angry excessively, that can also be an indication that they are struggling. Sometimes with especially young people, what we identify it based on their behavior, not what they say, but what they do, because children, adolescents, often they haven't developed this level of self-reflection sometimes, that they actually can explain what's going on inside. Sometimes it's more their behavior that we identify it on. For example, avoiding friends or social activities, things they maybe were doing before. People have difficulties understanding, relating to other people. Sleep disruption, feeling tired, low in energy, can be an indication that there is something wrong. Appetite, eating habits, sex drive, when there are changes in these things, also indications that something may be wrong. And then more severe, someone has struggled perceiving, understanding reality, having delusions, hallucinations, clearly sort of something is going on, they're experiencing things that are evidently not part of reality, maybe an indication that there is severe mental illness going on. Other issues, people who struggle with feelings, behavior, personality, don't have insight. People who use substances, alcohol and drugs, especially if they start using it excessively, significant changes, reason to wonder what's going on. And sometimes, and that this is quite common, that people struggle with physical complaints, pains, or worries about health. These can be also indications that actually there is, even though they are not focusing on the mental side of it, they may be focusing on the physical pain, struggle, but behind this may actually be a depression, anxiety, or some other kind of mental illness. Then people thinking about suicide, talking about death, about hopelessness, indications also that there may be a mental illness, mental struggles, and they need support and care. And then people struggling with functioning, not able to cope with the daily activities. And in general, what I would say, when someone is struggling with things that significantly impact their quality of life or their ability to function, quality of life and ability to function, when these things are significantly impaired, then it's time to seek help. So I think that was my last slide on this one. So this is a quick run through. This is maybe a bit intense. I will share my slides with Dr. Samraj, so he can make them available to you if that is desirable. So this is just what I want to with this is to give you almost a little scare about this situation, because that's what happened to me. In the fall, when this report came out from the CDC here in the US showing these dramatic increases in mental health issues, I got scared. I was expecting this. We all were expecting there to be mental health challenges and consequences to this pandemic. But the extent surprised me, and I think it surprised many others, even though we've been in this field and worked with this and had every reason to think that we would face challenges. Still, the extent is significantly up. It was not good before. There was the situation was that sort of, no, we don't really need to worry about these things before the pandemic, because too many people were struggling before. But with this pandemic, on top of all the challenges people are facing, I've been struggling with before, many people are now struggling, and that this will have a significant impact on society for years to come. And this is where my appeal is to all of us, to be sensitive to this, to take responsibility in this situation, and to be creative also in what difference can I make? What difference can my church make? What difference can my school make? What difference can my clinic, health institution, or wherever you are, what difference can you make? How can you help others? And in particular, my appeal would be especially sensitive to your family, to your own kids, to your spouse, to your parents, siblings, the extended family. Be sensitive to them and inquire how they are doing. Take time to talk, take time to process and reflect on the situation that we are in. So that's the first part. The next part of the talk that we will do after some questions and maybe a break. Then we'll talk more in general about mental health and what we need to cope and manage in this situation. Then I give the word back to the chair, so we can go on to the next phase.
Solomon. Dr. Solomon, are you there?
Okay, yeah. Thank you, Dr. Tobin, for the wonderful presentation. It's, I don't know, for some they must have felt it's very, very scientific, but that is what it is, because, you know, we have received a wonderful information. It's a compilation of evidence-based information, which is very nicely collected from good sources, like, you know, from Lancet magazine and also from APA and also from CDC. And it really presents a clear picture about what sort of mental health pandemic that we are experiencing and we will be experiencing in the years to come. And I'm sure that it raises our thoughts about the issue. And at this moment, I would request, first of all, the official speakers, respondents that we have in our list. We have with us Dr. Hansteck from CMC Vellore. I would request him to make his comments, please. Do we have Dr. Hansteck to respond to this speech?
Thank you, Dr. Torben. Sorry, I'd be driving on the way, but I've been listening to your message. I was not allowed entry because of, I think we had crossed 100 numbers, but I was listening to the YouTube. Really want to thank you for scientific expositions of putting the mental health into the perspective. One of the comments that I would put it is, since we look into our interests in lifestyle, we are looking into how does each of these things affect the other domains of our health. If you're looking at health as physical, mental, social, and spiritual, I think Dr. Torben has beautifully brought out the mental health component. And as we would realize that how mental health would be related to the social interactions and how that can impact our feeding and our physical activities, and all these things can finally result into various disease conditions. But really speaking, as more and more we think, the core of all these things are really a spirituality, or if I have to use the word, our worldview. It's the worldview that determines how I interact with people, how I am restful even in the worst of situations, how I am temperate in my decisions of life. And all those things put together is what gives us a health. And if we have to really understand where to invest, the investment is to helping people getting well connected with God. And if that is in the right connections, if our understanding about God and our purpose in life is right, I think everything else falls into place. So these are some of the responses and words that I have at this point of time. I really want to thank Dr. Tobin for his time and the sharing that he has done. And I wish all the audiences that you would really feast on the information that he has for us. Thank you so much.
Yeah. Thank you, Dr. Hansett, for your comment, especially for highlighting about the spiritual component, the existential and spiritual component, which is something that's been neglected by most people. As Dr. Tobin said, that a lot of people, even till today, are talking only about COVID as a infectious disease alone, but it is much more than that. I'm so happy that Dr. Tobin has helped us to look at this disease from different angles, and especially about the existential and spiritual aspects adding to that. I would now request our next official response. I think this is Dr. Sanjivan Arsud from Spicer Adventist College. Yes. Spicer Adventist University. Dr. Sanjivan from Spicer Adventist University.
Speak. Dr. Solomon,
Yes.
you can go to the next response by Dr. Paul Bhagyan, the Vice
Yes.
Chancellor of
Sure. Sure. Dr. Paul Bhagyan, yeah, Vice Chancellor from Northeastern University, Northeastern Adventist University. Dr. Paul Bhagyan.
I want to thank the organizers of this conference for this very eye-opening presentation. And I want to thank you, Dr. Tobin, for enlightening us on the importance of mental health and for bringing us the facts about it, especially as it concerns all of us here, especially in India. After listening to your presentation, I am convinced beyond a shadow of doubt that conferences such as this are really the need of the hour. And especially for India, we need to start talking and doing more, because I believe it will take nothing less than a tectonic shift to bring about a change in the mindset of people regarding mental illness. This is more challenging for us as Indians because we are much more a shame-based and a shame-driven society. Mental health has had its unsavory tradition of being attached with other stigma and taboo is still there with attached with this mental health. And I was astounded by the figures that come up in our journals regarding mental health. And I'm told that the WHO has already done a study and brought out the figures, and these figures are quite stark when it comes to the kind of assistance or kind of mental care, health care that we have in India. And in fact, the WHO states that in India, there are just about 0.3 for 3 psychiatrists and psychologists, nurses, about 0.12 nurses for every 100,000 citizens in India. And that's quite a startling number for us. In fact, I'm also told that India is now the suicide capital here, accounting for about 36.6% percentage of suicides globally. And that must tell us the reality of where we are standing right now. And I think what you did today by presenting these facts, you have opened our eyes to the realities that we are confronted with. And I think the dire need for us is now to be aware of how important mental health is, as much as we are concerned about physical health. And so thank you so much for your presentation. And I believe this will help us be mindful of those around us with such problems. And our churches, our schools, in our hospitals, we will be more mindful about how we can go about touching lives around us. So thank you so much for bringing this beautiful presentation to us. Thank you.
Can you hear me? The session is now open, please, for discussion. We request the participants to ask your questions, if there are any. Yes, Dr. Calvin. Dr. Calvin Joshua.
Greetings to all of you. It's a great joy for me to listen to my friend with whom I have worked as a Division Health Ministry Director. I appreciate his leadership and scholarship on mental health. I have a question. The alarming mental health issues are being addressed globally. I want to know what is Adventist philosophy of mental health for a time like this. Example, having worked with Dr. Nedley for 2 years, I'm spellbound with the health message upon the mental health patients. So I would like to ask a question. What is the remedial action that you would like to say or cast a vision for the world church to take advantage of a message or a process that will be a blessing for all the people of the world, particularly India? So I would like to find out, how do you want to put this into action when it comes to health message and mental health problems? Thank you.
Yes, Dr. Tobin, would you like to respond to it, or should we collect more questions now and then you would want to respond everything together? Dr. Tobin?
Yes, I was not able to unmute myself. I can respond to it. Thank you. I think it's best to take it one by one. Otherwise, I won't maybe won't remember everything.
Okay,
but thank you for that excellent question and challenge, which I think is a challenge to all of us. How do we make use of the health message that we as a church have and we've been given in dealing with the mental health aspect. I was called to the GC 2018 to work on mental health. There's never been a psychiatrist in the health department of the GC before, but this was a clear indication of the priority that is being given now to mental health. And we have to maybe admit that as we've been doing health and focused on health as a church for 150 years now or more, we haven't maybe paid sufficient attention to the mental health aspect of it. But this is something that we need to do more of. What I think is a key as we are seeking to promote mental health is the beauty of the Adventist health message is that it is comprehensive. It affects all dimensions of life, and we talk about, and I think we as Adventists, we should promote this biopsychosocial spiritual perspective of health. It's well recognized around the world now that we're talking about the biopsychosocial dimension, but we also include the spiritual dimension. Sometimes a bit sort of jokingly, I say sometimes we have treated the health message as if it was a diet message. That's not what we were given as a church. The church was not simply given a diet message about what we should eat and not eat. As Adventists, we've been sometimes too focused on just that. But our message is a comprehensive message where everything is connected with one another. What we eat impacts our mental health. Nutritional psychiatry is really growing and developing, but even mental health, the professional world hasn't fully recognized, I think, the importance of lifestyle. And I think that's an example where we can bring something in. And I think that's something that is very good when you mention Dr. Nedley and his program. It's a very lifestyle-oriented approach to mental health. And many people, especially people with mental health issues, they struggle with lifestyle and may have a poor lifestyle. And there are huge gains to be had. And that's what I also will share a bit, focusing especially on lifestyle in my next presentation. So this lifestyle dimension, the social dimension, I think that church in very much, it was not just created, God didn't just give us church because we were going to evangelize the world. We got church because we need family. We need connection, we need community. And that's something that we as a church can offer, this social dimension of life. Many people are struggling with that and have relationships that are not working well. And then if we can bring them into a church community that hopefully works well. Unfortunately, our churches, communities are not perfect. They're not, but there are places where we should always focus on growing. We all need to come into the church community because we all need healing, and we're all in this together. And we should work on developing healthy, heaven-like relationships and community in this world where we are already. And then I think, lastly, I think people in the world are facing huge existential issues. What is the purpose? What is the meaning of life? Why should I go on getting up in the morning? What is there to look forward to? And again, I think this is the comprehensive health perspective of our message, which includes the spiritual dimension, is also where we have something to offer into people who are struggling with mental health issues. I worked a lot with psychotherapy, so-called existential psychotherapy, where we work with these issues. What is the purpose? What is the meaning of life? And for many people with mental illness, that is a significant part of it also. And that's what I think this existential aspect of life have become very difficult for many people now in the midst of this pandemic, where the present there's so much uncertainty in the present, and the future is so uncertain, and people don't know if there is anything good to look forward to. The hope that we have as Adventists, as Christians, provide an antidote to despair that many people are facing in mental health. So I think the beauty of the health message is that it helps and supports people in every dimension of life, and one thing impacts the other. When we seek to help people to optimize every dimension of life, social or physical, mental, social, and spiritual, there will be gains to be had in every dimension as well, also when we do that. And that is the beauty of the Adventist health message, that it is comprehensive. It incorporates all these dimensions of life.
Thank you. Thank you for your wonderful response. Thank you very much. We would move to others if anybody else has got some questions to raise about. Maybe I would say that if anyone has any questions, you may put it in the chat. We will get back to you. I'm giving this suggestion because we are going to have a second session, and some of your questions may be answered in the second session. So it may not be necessary that we continue with that way. So you can always put down your questions. I mean, even during the session also, you can put down your questions, but in the end of the second session, we will come back to your questions first, and then we will have the discussion too. Is that fine, Dr. Edison?
Dr. Solomon, I think you may have the song to have a break, and then we will start with the second session.
Fine. Yeah. So the discussion session is now over, and we would look forward to the Adventist choir presenting to us a song. You can see, but you can't hear. Sound is going on, but nobody is able to hear. You want to comment, sir?
Dr. Solomon, the time is yours to introduce the second session.
Yeah. Okay. Can you hear me now? Yeah.
Yes.
Well, we are now moving to the second session of this program, and we have Dr. Tobin with us, and he's going to begin the second session. You know, we are actually running a little bit slow with time, so I would request Dr. Tobin to come forward and make his presentation for the second session. Dr. Tobin.
Yes, thank you very much. So I will share a presentation again
Yes.
here. So mental health and well-being and strategies for how can we optimize mental health and well-being. If my acknowledge that maybe there were a bit many references to scientific publications in the last one, I will show you a little bit of statistics in this presentation for the situation in India, just to give an understanding of what is the situation, but otherwise this will maybe be a bit more accessible, not as academic maybe as the other one. Dr. Samraj, he already quoted this about what mental health is. And the World Health Organization, they have this definition of what mental health is. And they say it's a state of well-being, and I think it's worth repeating, even though we've heard it once, a state of well-being in which the individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. Next part is about kids, and I think I will just skip it for the sake of time. But what I want to highlight with this definition that you may not notice at first glance, but this actually doesn't say anything about symptoms. Often when we talk about mental health, we list symptoms that people have. But I like this aspect and this perspective of this definition, that you can have mental health, good mental health, even if you are experiencing some symptoms. And I think that is very true to what reality is, that most of us, we will have some mental health issues. Maybe not illness, but all of us, we are in various ways broken. That is the reality. And I think that is, if we would be able to recognize and acknowledge that, that would be also a quite strong antidote to all the stigma that we have when it comes to mental health. Mental health issues are on a spectrum, from being quite well to people being severely ill. There is no one who has no mental health issues. And that is because we live in a world that is broken. And this broken world, it breaks all of us. And many of us at some point in life will find ourselves also having issues on such a level that we will need help and support, external help and support, and professional help and support for our mental health issues. And unfortunately, as also was mentioned, that access to care, access to support is vastly insufficient many places around the world. Even in the richest countries in the world, the most developed countries in the world, generally only half of all people who need care for mental health get it. That's the best case scenario in this world. And then, as you were mentioned, from India, where you have very limited availability of mental health professionals and access to mental health care is vastly insufficient. And here I would like to also make an appeal also, as you counsel young people what professional career to do, what direction to take in life, encourage people, if it makes sense, to also go into mental health and serve in that way in their communities. I found that myself, being a psychiatrist, very rewarding, very meaningful, and I'm very happy that I committed my life to working in this area of health. Just some of the statistics, what the situation was in the world when it comes to mental health before COVID-19. Reality is about 1 billion people in the world are suffering from a mental disorder. 1 billion. That's almost, not quite, but almost the population of India. A lot of people, almost 1 in 8 in this world, are in this very moment suffering, statistically, from a mental illness. That means they actually are in need of care, professional care and support. Only a small fraction of them get it. Anxiety and depression are the biggest illnesses in terms of numbers. Each of them about 300 million people suffering from this. And globally, there are about 800,000 suicides each year in the world. And it was interesting to hear it being said that suicides in India make up a significant proportion of that. I wasn't aware of that it was that big, but I'll show you also some statistics that support that suicides is a major issue also in India, and in many cases, not all cases necessarily, that mental health is involved. Sometimes there are other reasons why people choose to exit life through suicide in order to escape problems, but it is a major issue. One thing that is very important to recognize is that mental health issues start often at an early age. About half of all who will struggle with a mental health issue at some point in life struggle already when they are young, when they are kids, before the age of 14. And that's why prevention is so important. And good family structures, good schools, good church communities can make a big difference in this. And then tragic, sad reality is that suicide is the second leading cause of death in young people aged 15 to 29. Second leading cause of death, next or second only to accidents. Accidents is what kill the most young people in this world. Number 2 is suicide, and then down the list, various kinds of physical illnesses that kill young people. That's a tragic reality, tragic in the perspective that theoretically every suicide is potentially preventable. The seriousness of mental health conditions is that people with major mental health issues, they die younger. So this also affects longevity the people who suffer. So just some statistics, and I'll skip this one for time because it's a bit complicated to explain. But this one is a graphic showing the major mental illnesses. You can see in the upper right corner, you can see the different kinds of illnesses: schizophrenia, depressive disorders, bipolar disorders, anxiety disorders, and other disorders. And these are the prevalent cases per 100,000. That means in this very moment, how many in the Indian population, based on age, what age group they are in, are struggling with mental health issues. And there is a significant number. As you can see, when people start to see the significant increase as people enter into adulthood. And what surprised me, actually, when looking at these numbers, is that the curve for India looks somewhat different. And I apologize, I understand that you are representing 3 countries. So I pulled out the data for India, but I assume you are neighbors, and the situation can be similar in the other countries. What surprised me in seeing these numbers, comparing them to what I've seen many other places, is that the older population in India is significantly higher on mental illness than often see in other countries. In some other countries, we see a big, huge wave early on in adulthood, and then it sort of dies down. For India, it seems like it's more than other countries that the older population is suffering significantly. I found that interesting. This is historically the percentage of people in India struggling with mental health issues. And what you can see from 1990 up until 2019, which are the most recent data, is that numbers are definitely not increasing. There's a slight increase in mental health issues, not because of population growth. This is overall among people in India, that more people are struggling. So things are unfortunately not getting better in these terms. And as in the rest of the world, depression, this light purple, and anxiety, this darker purple, it makes up the big chunks of what people suffer from. Then I would go to the suicide numbers, and which we already touched upon. And this is actually where suicide rates are higher in India than in the rest of the world. So this is a comparison. To the left, you see world, about 10 suicides per 100 in the population every year. In India, it's up to around 14. So you are approximately, in general, about 40% higher than the global average when it comes to suicide. And of course, since you have a huge population, that means you account for a significant part of those 800,000 who die to suicide every year. And then if we consider based on gender, this is suicide rates for women, where you are doing significantly worse than the global average. And this has been, I know I've come across this before, suicide rates among women in India. Fortunately, and I don't have the graphic here, I could have shown it, but I don't take time for that. Fortunately, suicide rates in India for women have dropped significantly over the last decades. That's a good thing. Still, you are about twice as high the number as the global average. Again, something that indicates that being a woman in India is difficult when compared to the rest of the world. So this is something especially to be concerned about, even though it has improved from a very, very bad situation in the past. So how do we treat mental health issues? What do we do about them? And I just want to briefly run through some of where the major advances have been in mental health in the last centuries. A problem, huge problem before, and it still lingers on, is that in the past, and unfortunately still in the present, especially in some communities and cultures, mental health issues are seen as they are caused by moral, or spiritual and supernatural problems, issues. They have a moral or supernatural, spiritual explanation. And with this goes a lot of stigma. Fortunately, what has happened is that in the last century, we've had what we call the more biological perspective of psychiatry, psychology, that has entered, where we understand that mental health is related to especially the brain and the central nervous system of our bodies, and that things can go wrong, as things can go wrong any other place in the body. Also in our brain, in our nervous system, things can go wrong and people can become ill because of that. And that can be that it originates in the nervous system, the brain, problems that are primary there, or external issues that impact how the brain functions and operates. And that is many cases the case with mental health issues, external factors that play in, especially social, environmental, historical, biographical issues. And we can also include the spiritual issues that can play in a role there. So that has been an important way in order to counter the stigma and understanding that mental health issues actually is something that needs care and needs treatment, because mental illness is also physical, very much. It goes on in the body. The brain or the mind is not detached from the brain. Then other advances, what we call so-called talking cures, psychotherapies, counseling, have also seen major developments in the last century. Various types. There is no one type of psychotherapy or counseling that is the perfect, that is the biblical one. All of these come from very much like the secular world, but there are pros and cons to each of them, but they can be very beneficial to individuals. But what's good for one person may not be the right thing for the other person. It is, as all kinds of treatments, need the right treatment for the specific issue. Then there are various brain stimulation therapies, electroconvulsive therapy, these electroshocks that have been given, and now we developed other types also that have been important. Then in the last decades, what we call the psychopharmacology, medical treatment of medical illness through medication, has become very predominant in the way we deal with mental health issues. Major advances have been made. Many are helped. Some illnesses, in some mental illnesses, it's absolutely essential with medication to balance, to normalize the brain functioning. But on its own, it's not sufficient in many cases. Again, we need to maintain this comprehensive perspective of what a human being is and also what the mind is. So pill is usually not just by itself sufficient, but it has its place, and it's okay to use medication, just as you would use medication to treat diabetes, to treat heart disease. to treat cancer. It is okay as a Christian and as an Adventist to use medication in the way it is recommended, advised, and supervised by a health professional. Some people are very reluctant to use medication, and if there are other ways to achieve recovery functioning, that's fine. But for some, it's important also to explore the pharmacological, the pharmaceutical opportunities that are there. Then I would like to focus on lifestyle, also because I think this is where we as Adventists, and as already shared about our comprehensive perspective on health, including mental health, where we have actually something to contribute to how things are dealt with. And I've extracted some things from an article I wrote in the Adventist Review. The link to the article is there, and I called it Mental Health and Lifestyle. Is there a connection? And as you can probably guess, my answer is yes to that. So why should we focus on lifestyle also when we are talking about mental health? And again, when I'm talking about lifestyle, I'm not talking just about diet. I am talking in this biopsychosocial spiritual perspective, and that's what I want to share with you. Lifestyle is important because it affects how we live, not just how long we live. Sometimes as Adventists, we focused a lot about longevity, that if we live healthy lives, we can live longer. Well, people want to live well now. And that is where our comprehensive health message has something to offer. We're not just offering a longer life, we're offering a better life that people can have. But then it's important to say that the healthful, balanced lifestyle is not a guarantee against physical or mental illness. And we should never convey that kind of idea that if you just do everything right, then everything will be fine. This world is not fine, and we all live in the environment of this broken world. Some things we have control over, other things we have not. We do not control what happens around us, whether that is the environment, that's the geographical place we live in, the pollution, or the factors that play in. We don't control the people around us. We don't control that people at times will hurt us. So all these things, we need to acknowledge that in this world, we are faced with so many challenges and threats to our physical, our mental, our social, and our spiritual health. And even though we do our best, doesn't mean that there's a personal failure or fault if we get ill physically or mentally. But if we do things right, we optimize our chances of enjoying more years of health and happiness and productivity in this world. And I want to highlight 3 or 4 aspects of lifestyle that I think we all should be mindful of. These are important as we try to help others, but they're also important as we seek to boost our own resilience and ability to withstand the challenges that we may face and encounter in life. And I'm starting with sleep. Also because I think this is one of the things also that we as Adventists maybe struggle the most with. Some are very faithful, conscientious in diet, eating the right things. Some doing very well with exercise. Many, also especially leaders maybe, they make major compromises when it comes to sleep, and that's detrimental to our productivity, to our well-being, and to our mental health. Really, sleep is one of the best things that we can do to restore our minds and our bodies. And we all know the immediate effects. One bad night, the following day, you will be tired, you will not be as productive, and most probably you will not be as nice to be around as you otherwise would have been. Sleep is restorative, it is rejuvenating, and its effects is both immediate and long term. If we are sleep deprived, it destabilizes the brain, impairs memory function, and makes us more likely to swing between extremes of emotion. When the brain is underslept, the frontal lobe, the controlling part of the brain, it struggles to manage emotion, impulsivity, and reward seeking, and that can have major impacts on our behavior, the choices that we make. An underslept leader can be a quite dangerous leader. Underslept teacher is not the best teacher. Underslept parent is not the best parent. If we don't sleep enough, the risk of negative mood, irrational actions and decisions, aggression, behavioral problems, and addictions is significantly increased. We know that sleep disruption is part of much mental illness, but insufficient sleep in itself may also be a cause of mental illness. And almost all adults, almost without exception, less than 1% of the adult population can manage with less than 7 hours of sleep per night. In order for us to function optimally, most adults need 7 to 9 hours of sleep every night. And with that, we mean actually sleep time, quality sleep. Many of us don't get that. And kids and teenagers need significantly more. And I think this is a huge health problem that we have around the world, especially now we have devices that keep us awake and also disrupt our sleep, and many people are underslept. So this is important, and if you haven't prioritized it in your own life, then I urge you to take this more seriously, because you will do better and you will be more productive, and you will be nicer to be around if you sleep enough. Second is exercise, and exercise, really, physical activity is one of the quickest ways to boost our moods. A few minutes, just about any activity, and we will be reaping benefits. Still, what is recommended, the general recommendation is to try to get at least 30 minutes a day of physical activity, and it has huge effect also on our mental health as well as our physical health. Many people who exercise regularly, they do it as much for the mental, emotional benefits as they do for the physical benefits of it. And the long-term benefits of exercise in regard to mental health are well proven. People who exercise regularly report fewer days of poor mental health than people who don't exercise. And exercise, as I said, it can be preventative, but it can also be therapeutic for various mental disorders. So for someone who is struggling, it's even more important to exercise. Fortunately, we live in a world that is very sedentary. In the more natural world where we were farmers or hunters, we would get physical activity because we needed to work, be physically active in order to survive. Today, many of us live in houses, work in offices, work with screens. We exercise our fingers, but not much more than that, and that is not sufficient. Thing is, with exercise, anything is better than nothing. And if you're not successful one day, don't give up for the next day. It's very important to use every opportunity that you have. And one example is if you can take the stairs instead of the elevator, all these opportunities we have to just get a little exercise here and there, it can long-term make a significant impact. Diet, nutrition, which is very much a favorite topic for us Adventists when it comes to health, and for good reason, because it is so important. The foods we eat, what we drink, it becomes the bodies that we are. And if we want to have good, healthy bodies and good, healthy brains and a well-functioning nervous system, we should use good raw materials for that. What we eat and drink, it also affects our general well-being as well as our mental well-being, and that's well recognized now. Felice Jacka is one of the experts on nutritional psychiatry, as I mentioned, and she says this in general diets higher, and she's not an Adventist, but the message is close to what is the kind of diet that we recommend as Adventists. Diets higher in whole foods, such as vegetables, fruits, whole grain cereals, beans, legumes, nuts and seeds, fish, and olive oil are consistently associated with reduced risk of depression. On the other side, diets higher in junk foods, such as sugar-sweetened drinks, fried foods, pastries, donuts, packaged snacks, processed and refined bread, cereals, are consistently linked to higher risk of depression. And we see the same patterns also for other types of mental illness. Again, plant-based, whole foods diet as close to the way God created the foods, not something that has been through factories or is produced in laboratories. That's not what we were supposed to eat. We were supposed to eat food that God created as they come from nature. And that is proved to be healthy for our best for our physical health, but also has a significant impact on our mental health. This is not really very complicated. The foods that are good, the diet that is good for your body, is also good for your mind, for your brain. So it's a win-win-win. Then the social and spiritual dimension that I want to end with, relationships, so important when it comes to mental health. And that's often when we are, as I've worked as a psychotherapist with patients, it's often very much about relationships, also including the existential spiritual dimension of life is very important. So what happens between us and other people, and between us and God, is of utmost importance for our mental well-being. We are created for connection with other people and with God. We are inherently social beings, and we need to take good care of that part. It's one of the first messages in the Bible, also even before sin entered the world, where God states, "It is not good for man to be alone." That's one of the most fundamental truths that has ever been stated about humankind, about who we are. It is not good for us to be alone. Sometimes we live in a culture, or many of us, we live, that has become very individualistic, very self-centered, focused on what's mine, my performance, how I optimize my own life. But really, the good life can only be had when it is in the context of good relationships. And that is a biblical message that should be the Adventist message, and it is the message that people need to hear and need to focus on again and again. We need to be connected. We need intimate emotional bonds in nurturing relationships. In this world where things are difficult, where things are challenging, we need the support and comfort both of God above us and of fellow men and women, fellow human beings beside us. It is essential in order to live good lives. So Jesus' summary of the commandments: love the Lord your God with all your heart and with all your soul and with all your mind and with all your strength. And the second is this: love your neighbor as yourself. There is no commandment greater than this. This is a most excellent advice, truly, for maintaining good mental health. We need love in our lives. And it may seem like we're talking so much about that, maybe we get almost tired of it, but it's the truth still. We serve a loving God. He created us in love for love. And when that is lacking, people suffer. When love is lacking, people struggle with mental health issues. And that's one of the early on in my work with patients, it didn't take me long until I had the realization that a common denominator in the struggles of many of my patients were that there wasn't enough good love in their lives. And this is something where I think we as individuals, as church, as schools, as health institutions, wherever we come, we need to be conveyors of love in all that we do. It is essential because that's what we are created for. So I am coming to the end. I have listed some resources that I would recommend to take a look at. We have from the GC launched an initiative. We call it the COVID-19 Mental Health Initiative. And we have a website that has various kinds of resources, and I've compiled the mental health resources and this link, youthaliveportal.org/mental health. There you can find good resources on mental health. Also would like to recommend and consider this resource that the North American Youth and Young Adult Ministries have developed, called a mental health series, booklets on mental health, anxiety, depression, suicide, treatment, these kind of things. Very easy to access. It's free. You can download it. You can share it. PDFs that you can find on this resource link. Then Uncertainty Project is a collaboration between the Trans-European Division, the Inter-European Division, and the South American Division. And they started planning this in 2019, and they had no idea that the pandemic would hit in 2020. I think it's quite providential that they created this. And this is focusing on the way all the uncertainties that people are facing in their lives. Good videos. I would recommend that you check out this website. And then if you need to educate yourself, which you should do on mental health issues, a very good place to go is these mental health first aid guidelines. The principle, the idea is, philosophy is that all of us should be able to provide mental health first aid to people. That's not something that you need to be a professional to do. But in order to do that, you need to know some basics, and this is a good place to go. And then reminded.org is a mental health resource that we are working now on for the World Church here from the General Conference, and it will be launched early next year, and I hope that can be helpful. So just to close, like to just share this quote from Ellen White from the Ministry of Healing, which I think is very relevant for what our ministry as a church, as schools, wherever we are, it should be. There is a need of coming close to the people by personal effort, relationships. If less time we're given sermonizing, not that there's anything wrong with sermons, but if less time were given to sermonizing and more time spent in personal ministry, greater results would be seen. And then she lists, and this is very much what health ministry also should be about. The poor are to be relieved, the sick cared for, the sorrowing and the bereaved comforted, the ignorant instructed, the inexperienced counseled. We are to weep with those who weep and rejoice with those that rejoice. Accompanied by the power of persuasion, the power of prayer, the power of the love of God, this work will not, cannot be without fruit. I think this is actually a very good strategy for what church should be like. It's a good strategy for what schools should be like. It's a good strategy for what health institutions should be like. It's a good strategy for how we should live our lives, each one of us. And I would recommend to take this to heart, coming close to people, building relationships, taking part in their lives, not just preaching to them, but being with them in everything they experience, being with them in their struggles, helping, supporting in the ways we can. And the promise is that will bear fruit because it has so much value in itself. So that was this next talk. Now I give the word back to the chair.
Thank you, Dr. Corbin. Thank you very much for a wonderful presentation. Especially, I was very happy that you took on this topic of mental health in India in your second presentation, and it was a nice way to explain about what mental health is all about. The concept is not very clear to most people, but the explanation that mental health consists of realizing one's own abilities, and that's one's own strengths and so on. And also it deals with coping mechanism, the way that a person is able to cope in this mental health conditions, and also the ability the person has to work productively and fruitfully, and that makes actually the mental health or mental well-being of a person. And it was also nice to know that there is about $1 trillion is spent a year on mental health. That's really an amazing, huge amount. I think in India, we would call it as 100 crores. That's the same as $1 trillion. And that's really a very, very big amount that we have been spending on these mental illnesses, especially about depression and anxiety and suicide issues. And in fact, in India, one study about million deaths, a study of India's own study on million deaths says that there is about 250,000 suicides are taking place in India, but that many numbers have not actually been reported, which means that it is actually double to the reported suicides that are actually taking place in India. So that shows that suicide is a very serious issue in India, and it is a second leading cause of death. Well, we would have been happy to listen more about a topic which you touched and you wanted to go a little more deep in, but of course time would have permitted us. I'm just talking about this studies conducted by Global Burden of Diseases. I think you are talking about the Seattle-based institute that is Health Metrics and Evaluation. But of course, it's a wonderful study, wonderful information is there, a lot of good data is there to understand about this mental health issues from there, but we do not have time for that. But what I like most about your presentation today is that how you are able to emphasize the importance of biological, psychological, social, and spiritual. Okay, that's where when you touched about spiritual, you talked about the this eclectic approach by mentioning that existential and spiritual aspect cannot be ignored. This is something that in a secular world we hardly hear about it, but we certainly cannot neglect this part of it. And also very interesting to listen to it was that how you connected that out of these 8 laws of health that we Adventists promote very much, at least 4 of them are very directly connected with our mental health, especially about sleep and exercise and nutrition and relationship specifically with God is a very important thing that we need to take into consideration. I am sure that we as Adventists, if we continue to follow these 4 of these health principles that you mentioned right now, we will be able to overcome these mental health problems in a much greater way. Thank you very much for the wonderful presentation. I would now keep this session open for discussions. Okay. Well, the session is open for discussion. Anyone who has any questions or comments, you're welcome to make your questions or comments. I was looking at the chat box too, because I said that if you have some questions during the session, you could have put it. Or if you want to put the questions in the chat even now too, you are welcome to do that.
There's a hand up there, Dr. John Solomon.
Yeah. Just go ahead, please. You need to unmute yourself and raise your question.
Pastor Augustine, you have a question? Please raise your question.
I want to thank the Health Ministries Department for making effort to conduct this webinar. And this was a very fruitful exercise to invite an international speaker and convey this very important message to our Adventist family. And we also want to thank Dr. Thorbin for his time, valuable time that he has given to upgrade and help us in this resource. I want to appreciate the Health Ministries Department and the resource personnel for this wonderful meeting.
Thank you, Pastor Augustine. And Pastor Dr. Solomon, you would like to open the floor for further discussions?
Yes, we can still keep the session open. If there are any questions or comments, we would still welcome you to, yes, Pastor Prakash Mari.
Dr. Solomon, I'm so happy to hear your voice after a long time.
Thank you. Thank you very much.
And I'm so happy from the division, Dr. Edison Samraj and our union health director has taken this initiation to see that this health program comes and the awareness of the COVID-19, which was given to us by Dr. Thorbin. It is a marvelous, it's a scholarly presented paper. Yet in it, it has got content about the Adventist principles of establishing health to the Adventist vineyard. And I'm sure the message that was given to us through the division, through union, and to the lay members, and the initiation of Dr. Torbins gives a marvelous ideas and insights how to develop physical, mental, social, and spiritual growth in the life of Seventh-day Adventists. I have a question to ask Dr. Thorbin. Dr. Thorbin, as you know that the United States is now very largely affected with the COVID-19, and it has given a lot of impact on the Christian world of the Seventh-day Adventist Church, where things have come to an halt. What is the method that your study in Maryland brings out to stop the COVID-19 to the affected people of the Seventh-day Adventist and all in your ministry? Dr. Edison is giving a very good smile, healthy smile. I think Dr. Torben knows what I'm trying to ask him. Dr. Torben, we are told here by the local people, drink this, drink that, and make yourself. But you have involved yourself with the spiritual activities. So what is the method that you are trying to bring out as a Seventh-day Adventist World Center organization in your place to stop the COVID-19 at your place?
Yeah. Well, then we are opening for a broader talk about COVID-19, and I'll be careful not to step beyond my limits of competence in this. But I'm a psychiatrist and also a medical doctor, and I'm trained in general in this. I think what this pandemic has exposed, it has exposed many things. And it has exposed the vulnerability that people have to jump on the bandwagon of all kinds of crazy ideas and theories that are not scientific. We have lots of conspiracy theories, and we have that within the church and outside the church. And I think what we see inside the church is very much like a reflection, in a way, of what's going on in the world in general. So I don't know if we are better or worse than the world in general. Again, as Adventists, our principles when it comes to health is that we base what we recommend, what we pursue on the Bible principles, on the teachings of Ellen White, and on science. And when these three sort of sources of knowledge about health, when they are in harmony, we think that we are on safe ground and we can pursue and recommend things. And in this case, sort of, we think that we need to follow the advice that the scientific community is giving us. That's our stance as a GC Health Ministries, that we believe that vaccines is one of the best inventions of modern medicine. Truly, it's one of the greatest success stories of modern medicine that we've had. It's been discredited, and there's lots of conspiracy theories around vaccines. Of course, what we know that nothing that we do as human beings is perfect. And also when it comes to vaccines, any kind of intervention where we try to treat, manipulate nature as we're doing with all kinds of treatments, then there may be some people who also experience negative effects of that. And but our stance in general is that we think vaccines is a good thing. And we recommend that. The challenge is that there are being developed many different kinds of vaccines. Some may be better than others. Time will tell. But we need to leave that to the scientific community and follow what is when they do good research on things. Listen to sort of what they figure out. So our stance is we believe that, and we recommend that people are vaccinated with good vaccines, as is recommended by authorities. We do not believe that there's a big conspiracy behind these vaccines. But again, caution. At the moment, in Europe, there's a struggle with one of the vaccines, the AstraZeneca vaccine, where we don't know sort of if it may increase the risk of blood clots, and that's being thoroughly investigated, responsibly handled. But again, it shows that when we are entering into new territory, then we don't know everything, but we still need to act in order to save lives. So we believe in order to counteract and stop the COVID-19 pandemic, we think vaccines is crucial, social distancing, using masks, these recommendations that have been given, they have been proven to work. And that's also what is our recommendation, that we follow these things. And of course, on top of that, this healthy lifestyle in general is beneficial. All these things that we can do, optimize our diets, our exercise, our sleep, our mental well-being, our spiritual well-being. These are also things that will increase people's resilience when faced with potential infection by this virus. So we believe to take like all of our health message, and including using the best from the world of medicine, and we think that's the way forward. And hopefully, in some months, this pandemic will be more under control. I don't know if that was what you were asking, or if that you wanted me to say.
I was just trying to get the pulse. Why? Because the Seventh-day Adventist Church in the Southern Asia division is more or less in the dilemma: should we take vaccine or should we not? Or should we go to the principles that you mentioned: good sleep, good exercise? This is what good diet. This is what you mentioned, and that is what I think is trying to bring more spiritually close to our Lord. Because of this pandemic has blown up the mind to be how close you are with your Creator, and it's such a thank you so much for your insight, and God bless you in your ministry. And we are privileged to hear from you. Thank you, Dr. Edison, Dr. Solomon, and our union health leader. Thank you so much.
Thank you, Pastor Mali. Yeah. Thank you for your question and for the discussion that it generated. Yeah.
Can I just say?
Go ahead.
Can I just say?
Yes,
so
please.
the question was sort of should we follow that this health message, or should we take vaccines? I would say do both. It doesn't need to be a choice between either or. Right. Do both. Right. Yes. Everything that can help, do it. And that's my recommendation also when it comes to mental health. Sometimes people say, well, should I take medication for that? Well, let's say do lifestyle, do counseling therapy if that helps, do medication if that can help, do everything you can to get well and to improve your health. It doesn't need to be sort of either or. Sometimes we create these sort of false conflicts. And I think especially with this pandemic, do everything you can and recommend your members to do everything they can in terms of the health message, including the spiritual dimension and connecting with God. But that doesn't in any way need to exclude using the best from medicine, including vaccines. So do everything we can to counter this pandemic.
Thank you.
Thank you, Dr. Corbin, for clarifying this issue. Yeah, there be no confusion about it. Yeah, I do believe that these 4 health principles that you touched upon are essentially good as a preventive measures, and I'm sure following them would also help to build up our immunity. But vaccine is there, and vaccines are also required to protect us from the infections.
Thank you, Solomon, for inciting, and thank you. Good to see your face again. In the future, we look forward for the Western India Union to be marvelously vaccinated.
That's right.
Thank you. God bless. Bye.
Yeah. Right. Any more questions, please?
Yes.
Go ahead.
Ask. Can you hear me?
Yes, we can hear you. Please speak.
Voice is clear.
Yeah. Speak na, ask.
Doctor, can you tell me the signs of psychological problems after the pandemic? What are the symptoms and signs of psychological problems after the pandemic?
Yes, thank you. Well, they are basically the same as they always are. So the list that I shared with you, sort of indicators that someone may have mental illness, that those apply whether it's in the context of this pandemic or otherwise. Generally, it's what to look for is when people are struggling in their behaviors, in their thoughts, or in their feelings. That's in general what we should look for. Sometimes this is something we can observe. We see that their behavior is different. We see on their facial expression, maybe they're crying, that it's different, maybe the way they talk about things, the things they express, that things have changed, that they are worried, that they are depressed, that their mood is down, that they are anxious about things, or more severely, if they are somehow, we feel that they're losing grip on reality, that clearly there are things going on in their mind that is they have beliefs, they see things, they experience things that are not real. These are indicators that people are struggling mentally. So especially when you see, what I would say, when you see changes, especially when you see significant changes in behavior, in mood, in thinking, that's especially when there's reason to inquire and to talk about what's going on. None of us are mind readers. We need to use our eyes and our ears when we interact with others to try to understand what is going on. And one of the best ways is to ask questions in a supportive way, not aggressive. Oftentimes we know that it can be quite shameful. People can be struggling with guilt if they are having mental health issues. So it's important that whenever we provide and try to understand what's going on, that we do that in a loving and caring context, so that the person can feel safe in order to express what is going on. But I would recommend that if you wonder and worry about someone that they are struggling, then do something about it. Interact with the person, talk with them, engage with them, and try to figure out what's going on and what kind of help they want, what you can do, and where you need to get them and support them into getting help from others and professionals if that is needed.
That's fine. Thank you. Thank you, Dr. Corbin, for these concluding statements.
Thank you, doctor. My question was that after the pandemic, what are the changes? Like we have seen many reports that some doctors have done suicide in New York, that changes are in the pandemic and after the pandemic, like right now the doctors especially facing, because that was what I was wanted to know, the behavior changes, behavior of the in the pandemic, because now we have seen so many reports that so many doctors have done suicide. That's like shocking, no? So what are the changes in pandemic? In that regard, I have asked the question.
Okay, I'm not sure then that I quite understand what you are wondering about. What kind of change are you thinking about?
We have seen so many suicide cases among the doctors. Why is that?
Well, I think that doctors and health professionals have been under extreme press or stress and pressure for a long time, and we've seen that also other places in the world, suicides, because they are just overwhelmed. And that's sort of an expected response in a way. Just it's an indicator of the extreme pressure that many health professionals, who are only human beings also and have their own challenges, their own life, and things that they are struggling with. In general, when it comes to suicide, what I want to say is that there are very seldom that people actually want to die. Suicide usually is a way to escape problems, escape pain, when the people feel that they're stuck in a situation that they cannot get out of. They don't know how to deal with it, how to cope with it. It's just become unbearable, whether that is because of emotional pain or there are other kinds of pressures that people are having. And I think in this situation, and we know that with health professionals around the world, with this ongoing pandemic, sick people dying, patients dying, the health professionals are traumatized by what they are experiencing and what they are seeing. So, and this again will leave lasting or have a lasting impact on them. It will take time for many of these health professionals to recover from it. And that's why I think it's very important also with these mental health issues to be especially attentive to the health and well-being of the health professionals who are trying to save lives of their patients, and that we as community, as institutions, that we are especially sensitive and ask them how they are doing and what they need in this situation. So it is a very difficult time for the world, for society in general, but our health professionals have been under exceptional stress and pressure for a long time, and that has also mental health consequences for them.
Thank you. Well, I think it's time for us to wind up this question answer session if we do not have any more questions, and let us move forward. But before this, I want to thank Dr. Tobin once again, and I want to tell him that there is much we could learn from what you have presented today. And I have a small suggestion to Dr. Edison, that it may be better that we take a resolution from this message that we have received today. And this resolution could be such that, we as Adventists in Southern Asia Division, as we look into this, as part of our response to this COVID pandemic, especially in the context of mental health, we should take a resolution stating that we would follow this eclectic approach that we have discussed at this moment, an approach in which where we look into or take into consideration the biological, psychological, social, and existential and spiritual aspects for our well-being together. And then moving ahead with regarding to preventive measures that could prevent the mental health complications in the lives of our people, or as the 4 health principles, part of the 8 laws of health, that is sleep, exercise, nutrition, and relationship with God, also to be taken more seriously in our personal lives, so that they would work as a preventive measures and also promote good health by granting us a strong immunity against the COVID disease by strengthening us psychologically and mentally. I think a sort of a resolution like this could be shared with the leaders in the division and also be promoted in our schools and in our hospitals and in all our institutions. It would be a very right thing to help our people to face the mental health challenges that we are going to experience in the future. Thank you.
Dr. Solomon for chairing the session, and thank you, Dr. Torben, for making that very comprehensive, compact presentation, which was very provocative, prescriptive, and promising for the future. As it was suggested by the chairperson, I think it is in order to have a resolution passed as a body of health professionals, institutional leaders, and students coming from various colleges, that we take up this challenge of fostering this lifestyle change as a way to life and making immunity work. In fact, I want to tell the audience today that we have taken two major initiatives in the same direction. Dr. Solomon and Dr. Torben, you'll be happy to know that we have taken the 12 principles of health, not just the four that Dr. Solomon mentioned, but beyond the four, we have gone to the 12 principles that is an acronym, celebration. I think some of you might have received this magazine. It is the 12 principles that constitute holistic education, which we have initiated in our schools and in our church premises and our Sabbath school divisions. So we have already taken a step forward to do a preventive aspect in how we can lead our members to make every church a center for healing and every school a center for healing, and to make this a reality, not just a resolution, but in action. We have taken this. In fact, last week, we introduced this holistic lifestyle concept to non-Adventist schools, where about 300 principals had come for orientation to this very important concept. So I think it's in order. We will take this resolution as it is suggested by the chair to make that part of our program. And I want you to take that message and create awareness programs on this mental health issues, orient the members, orient the leaders to these important issues, and offer strategies of how you can offer to manage the crisis. With that, I would like to say a few thoughts that are in conclusion. Number one is that we need to move towards a holistic program for not only our schools and our colleges and our churches, but for the world. And we show that by our praxis. And I think that's an important imperative. The second thought that comes to my mind in conclusion to this webinar on mental health is for each one of us to take personal responsibility to build the church in this direction. I think that's the call for today. And I want to show you this book that we have just released about a month back, and it is called COVID-19, How to Prevent Getting Infected, written by one of our able doctors from CMC Vellore, Dr. Rajaratnam Abel. I think we have passed on these copies to all the union leaders, and you can get one of the copies in case you need one from them. And this is a book that I want to show you, which is actually applying the 12 principles of health to our school curriculum in integrating the head, heart, and the hand. So this is from standard 1 to standard 10, giving this same principles of what the four pillars that Dr. Torben talked about, elaborating it a little more, expanding it to 12 principles, and applying it for a holistic lifestyle that will enhance mental health. So these are the two major initiatives that the church has taken, and you can take many more to make this a reality in your region, in your institution, and in your country that you belong. And if there are citizens from Nepal, from Bhutan, and from Maldives, I know there are 2-3 people from Maldives listening to this presentation. There are 4 individuals from Bhutan listening to this. And I want to say the King of Bhutan is anxious for the Adventist message to come into Bhutan. And I believe the health message is going to be a prominent one. And I believe that also in Nepal, we can take the same initiative. So it is a call to all of us to be partnership in this growing process. And as a Health Ministries Director, I want to challenge you to take that responsibility. So we close this session with concluding remarks from Dr. Wilson, and he will offer the prayer. And before the prayer is offered, we will have a song, and then he will offer the prayer. I request Dr. Wilson to come forward and make his presentation and make his remarks, and as well as after the song, he will offer the dedicatory prayer.
true. His mercy proves His love. Praise the Lord and for Your glory. Praise the Lord and for Your praise. Praise the Lord. Now lift up your voice. Lift up your voice. Praise the Lord. Praise the Lord. Great are You,
Good evening and greetings to you all. We are very happy that our health department celebrated the good news of God's grace through this webinar. We want to thank the choir that sang two wonderful songs, praising the God who blessed them with joy and grace. We want to thank the General Conference resource personnel, Dr. Torben, young and dynamic from Norway, Sweden, I think. Norway. The topic that is selected is very interesting, very profitable, and very much needed to this day. Even in India, young adults, young professionals in Tollywood, Hollywood, some people, many of them committed suicide during pandemic because the situations did not meet their expectations, they could not meet because of the pandemic. We want to thank Dr. Solomon and other doctors who have participated in making comments. We want to thank Dr. Solomon for coordinating. When Dr. Edison invited me to be part of this, I did not understand it is such a valuable one, very enriching, very much needed. Personally, I would like to thank you all. Many people are benefited by this, enlightened. This is the message the Lord has given to us and we need to share. Mental health, people do not pay attention, maybe only to the body. But unless our mind is clean, mind is pure, mind is tuned, we cannot maintain proper healthy body. They have strong interlink and we want to thank the different way of analysis, the ratios they have shown. Everything is very important and it is most needed problem that need to be addressed today and be educating our youth. I want to pray before we close.
Before Dr. Wilson prays, I would like to say those of you who have given your names to your respective institutional heads, especially the nursing students and the college students, you will receive a certificate of participation signed duly by the concerned authorities. And I would like to symbolically ask Dr. Wilson, our Executive Vice President, the Executive Secretary of the division, to actually share this certificates with you so that you can see it for yourself, and please hold this. We symbolically give to every participant and it will come to you by courier to your respective institutions, and you can keep it as a credit for your participation today, and your respective institutions will give you credit for these 2 hours spent with us academically as well. So this is our commendation to you, that please ensure that you send in your names to us and we will make sure that we give you the certificate of participation to everyone who participated. Thank you once again, and Dr. Wilson, please lead us in your prayer.
Shall we bow our heads wherever we are? We will thank God for His blessings. Our most loving and caring God, the King of our lives, We thank you today for the privilege to enrich ourselves through the current issues, dear Lord. We want to thank you that you are a caring God, loving God. Even through the pandemic, you can sustain us, dear Lord. We thank you for the Adventist Church and the priority and the gift of health, the health message. Today, because through your servant, Dr. Turban, we have learned something very special. Mental health is important. Many of our people have psychological problems, situations, and therefore we need to learn why and what. God of heaven, we thank you for all the participants. You'll bless each of them. Help that we will carry a burden in our heart to share these messages to the neighbors and friends, into our church members, dear Lord. Help us to motivate our young people to look at mind and body and the spiritual strength, everything socially and friendship, all these to be a balanced one. We thank you for the comprehensive health message. We thank you, dear Lord, for the people who has a burden to share and organize this kind of webinars. Continue to enrich us. Forgive our sins, bless us and our families. As a church, help us to shine together, to show to the world that we serve a living God who understands the health and who guides us in the time of need. Forgive our sins once again. Bless all of us. Thank you for these wonderful moments of learning and enrichment. In Jesus' precious name we pray. Amen.
Amen. Thank you, Dr. Wilson, and thank you once again for your participation today in this webinar. And God bless you all and have a wonderful evening. Thank you once again, and God bless you.